Hi everyone, today we're going to go over the impact of injury on cell types that are present in many organs. So just a refresher on epithelial cells, these are formed cells that line cavities in the body and cover flat surfaces. So you can find these cells in our skin, our respiratory tract, as well as in our GI tract. Epithelial cells can differentiate and undergo rapid proliferation, so when our epithelial cells are injured, they're easily replaced. And nothing can leave or enter the body without passing through or between cells that form the epithelial boundary. Endothelial cells are cells that line blood vessels, so you can find these in our arteries, our veins, and capillaries. These cells act as gatekeepers to tissue compartments, and they facilitate an enhanced vascular and tissue response to injury and inflammation. These cells present as a barrier to excess injurious cells and agents, and they also protect our vasculature and our tissues. Majority of epithelial cells are in contact with the external environment, and this has a large impact on their injuries. So a lot of times mechanical damages from cuts and scrapes can cause injuries, as well as active penetration from mosquitoes, parasites, and hypodermics, bacterial fungal attacks, and poisoning by toxic chemicals, and these all cause injury to the epithelial cells. When an epithelial cell is injured, blood leaks out that allows microorganisms to enter, and factors that activate fibroblasts are released. And then collagen and fibronectin are produced that create a plug for the compromised epithelium. Most epithelial cells have an automatic ability to deal effectively with injury, and they do this by replacing the lost tissue with new growth from undamaged edges. When an epithelial cell's ability to divide is stimulated inappropriately, a tumor may result. And if neoplastic cells respect the basement membrane, the tumor will remain localized. But once they break through the basement membrane, they can enter circulation and metastasize. Injury to endothelial cells are caused by an imbalance between vasodilating and constricting substances that are either produced by or act on the endothelium. And some of the triggers for endothelial cell injuries include bacterial or viral infection, oxidative stress, and environmental irritants. And some of the clinical manifestations of endothelial impairment include hypertension, edema, abnormal vasoconstriction and dilation, and hypercoagulability. Initial and slowed responses are different for injury to endothelial cells, and they ultimately result in vessel remodeling, including profound changes in the cellular architecture. So an initial rapid response includes changes in levels of nitric oxide, prostaglandins, ET1, von Willebrand factor, and tissue plasminogen activator, and the slower response depends on fundamental changes in characteristics of the surface, so alterations in the basement membrane and the cells that surround the endothelium. And impaired endothelial function is associated with hypertension, diabetes mellitus, and heart failure. And when these cells are injured, it may be an initial step into atherogenesis, which a lot of the times leads to ischemic heart disease and thrombolytic strokes.